Do the final lesson for the evening, which is really just the second lesson. Two weighty lessons here: illness and drugs. Some of this material we covered last weekend, and so we actually won't be going over a good portion of section 3. We're talking about illness, drugs, basically, medication and counseling. Now, there are myths, and a lot of these notes are coming from or influenced by resources like Heath Lambert. So I'm looking at the end of the lesson here, point 6. Heath Lambert, The Gospel and Mental Illness. It's like this big. Okay, you could read it in an hour. And it might count for your book reading for the year. But it's also very helpful. Resource E, Daniel Berger II, The Chemical Imbalance Delusion. The one before that, Mental Illness, he has 5 volumes on mental illness, and he does a great job. But if you want to read just on the issue of the chemical imbalance, we've talked about that last time. And one of the things that I love about Daniel Berger's research is he does approach it from a biblical perspective, and Scripture, the book is replete with Scripture. But another thing he does is he uses the writings, the researched, the peer-reviewed articles, all that from non-Christian sources to argue against the validity of the chemical imbalance theory. So it's perhaps even more convincing than others of his books. There is a video, Jeremy Pierre, Is It Okay for Christians to Take Antidepressants? I think it's a 20-minute video, something like that. It is a wonderful video on the nuance of the question. And his is a very pastoral and steadfast to Scripture response. So I think that's a good source. If you are interested in reading some from the secular area, The Emperor's New Drugs, Alan Francis's Saving Normal, and Greenberg's The Book of Woe are good places to start. I will tell you that Greenberg's The Book of Woe has quite a bit of language in it as he's interviewing individuals, and there's also some illustrations some cases that are hard to read regarding sexuality and children and power and pain and things like that. But it's a good book to help us to get a better understanding of how the secular world views the DSM. We've talked about the DSM, and we're going to talk more about it tonight. But first, some myths. Biblical counselors. So 3 myths here. Biblical counselors tell counselees to quit their psychiatric medication. So that's a myth. I can't say that no biblical counselor has ever told his counselee to quit medication, but that would be abnormal behavior. Pun unintended with psychology language. The ACBC, again, Association of Certified Biblical Counselors, they have made a statement. They have a written statement on their website about how they understand medication and counseling and practices for counselors, and we have to sign off certain standards of conduct, and this is part of it. We do not tell our counselees that they should quit their psychiatric medication. It would be out of bounds for biblical counselors, and it'd be out of bounds for a lot of secular counselors or psychiatrists, psychotherapists. It would be out of bounds for a lot of them to tell others to stop taking their medication. It would only be right for the doctor who prescribed it, right, to say, you should stop taking this, or let's talk about how you can stop. Or the person switches office and doctors and gets a referral or gets release information and all that. Counselees should always be referred to their doctors for guidance. Even biblical counselors who are medical doctors do not tell their own counselees to stop unless they were the ones who put their counselees on the medication. We talked about that a time or so ago. There are many biblical counselors who also work as physicians. Dr. Charles Hodge is one of them, or Hodges. He's one of them. And I think I mentioned that last time, didn't I? He has a practice, and then he does counseling usually in the evenings or so. He doesn't tell his counselees to stop their medication unless he's the one who prescribed it, but he usually doesn't mix those two. Myth number 2, biblical counselors are anti-medicine. I cannot say that no biblical counselor is anti-medicine. I know of some counselors, maybe some first generation or older school counselors who might be more anti-medicine than others. But by and large, this is not the case across the board for biblical counselors, especially it's not the case for those in ACBC. Like I said, they have a statement on their views regarding this. So it's not true confessionally, as they have confessed. It's not true practically. The Bible itself encourages the use of medicine as a common grace. Think of Paul, who tells young Timothy, who's got a significant tummy ache, he says, go ahead and take some wine for that stomach, for that ailment. Embodied beings require help for their bodies. We would be foolish to think otherwise. Rule of thumb, when in doubt, check it out. So your job as someone is sharing some trial that is affecting their body, you say, well, have you talked to your doctor about that? Now, we talked about the wisdom required in referring someone to a doctor. And if you have a list of, maybe the person doesn't have a doctor, but you have a list of physicians who are at least sympathetic to biblical counseling, that would be ideal. Because sometimes, or most of the time, if someone sees a psychotherapist, for instance, then the person is going to quickly be prescribed some medication. Even though we are not against medicine, we do not buy into the theory that all problems are physical problems. Every problem is always at least spiritual and may involve bodily relief, bodily care, or cure. Third myth, biblical counselors only confront sin. This is what Jay Adams was accused of time and again. And remember, he was the founder of what's called nouthetic counseling, and nouthetic has to do with confronting or admonishing, warning. So he's had a bad rap for confronting just the person's sin. And that's not accurate of his practice, but he did see the relevance of addressing underlying sin. Sin is confronted, but suffering is addressed as well. And that's one of the contributions of later generations of biblical counseling, is that they have seen suffering as a significant category for counselors to be mindful of when they are assessing a counselee's problem. And usually we lead with hope and comfort and sympathy for the person's suffering, and then we'll address the matter of sin and how the person is sinfully responding to the person's trial. So it's not true that biblical counselors only confront sin. Normal, abnormal, and mental illness. Fundamental to this discussion is discussion of worldview thinking. We would be wrong to think that the secular world has the same mindset that we have regarding the human being, regarding God, regarding fundamental problems, regarding solutions. Secular worldview is materialistic and it is reductionistic. The mind equals the brain. So all real problems are physical problems. But the biblical worldview is that the physical and spiritual problems exist in a psychosomatic unity. Remember, psycho would be spirit and somatic body, soul-spirit unity. We understand the interplay of these two constituent parts of the human. Sometimes the soul is affecting the body, sometimes the body is affecting the soul. Medical versus psychiatric diagnoses. A medical diagnosis is one that is organic, one that has a physical problem with an identifiable pathology, identifiable suffering, and source of disease. Whereas a psychiatric diagnosis has no identifiable, sorry for that misspelling there, no identifiable pathology. A psychiatric diagnosis consists of the psychiatrist hearing a person listing off, describing problems, and then saying, okay, here's what you got, and here's some medication for what you got. We talked about this last time. There's no blood tests or CT scans, anything like that. This is where it gets, I think, misleading. Here's what a lot of secular psychologists and psychotherapists are going to say, is they're going to say that their approach is clinically proven, or it has the backing of clinical research. Clinical research is simply the person listening to the patient and then listening to enough patients who describe similar problems that they then, match up with the Bible of psychiatry, the DSM, in its 5th volume, or 5th edition. It's not, well, let's address actual biology. Let's take a sample. Let's have some scans. That's not that at all. That's one of the problems of psychiatry is and how people understand and how diagnoses or problems are being communicated through advertisement. You would just essentially equate psychiatric diagnoses with medical diagnoses. And they're not on the same level. What is mental illness? Psychiatry does not diagnose mental illness the way other medical doctors do. Biopsy, CT scan, blood test. Even secular psychiatrists have difficulty defining mental illness. So I mentioned Alan Francis, his book, Saving Normal. He says, and he was I don't think he still is, the head of Duke University's School of Psychiatry, and he was the chief editor of the 4th volume of DSM. And he was involved in the 3rd volume as well. And here's what he says. This is not someone who's sympathetic to Christianity by any stretch of the imagination. I have reviewed dozens of definitions of mental disorder and have written one myself in DSM-4 and find none of them the slightest bit helpful either in determining which conditions should be considered mental disorders or not, or in deciding who is sick and who is not. Here's a leading guy, and he caused some, I think he caused some problems for board of psychotherapists. No, it is not. And he says this is cited in the Book of Woe, that Greenberg book, because Francis was interviewed by Greenberg. Francis says, there is no definition of a mental disorder. I mean, you can't define it. So if leading proponents, even of secular solutions, if they are saying, we really don't know how to define a mental disorder, and even the ones that we have here are they're not very helpful in distinguishing what's a mental disorder and what's not, and who is sick and who's not sick. That's a problem. Fundamentally, that the foundation is not strong. A diagnosis of a mental disorder is not a medical diagnosis. It is an examination of a description of the patient's behavior and thoughts, and it's very subjective. I'll bypass the Rosenhan experiment, but maybe take some time to. It'd be good for you to just look it up. Look up the Rosenhan experiment, and maybe tomorrow, if there's time, I'll look at that. But essentially, there was this group of people headed up by I think it was Rosenhan. That's why it's called the Rosenhan experiment. And he told a bunch of his researchers to go into these asylums and say that they hear a sound and that they're kind of going crazy, and don't take a shower for like a couple weeks. So they're going to these different areas and see what happens, see if they're going to get admitted. And they all get admitted and diagnosed with, I don't remember if it was bipolar or something like that. And then they try to get out. Then they start acting normal because they actually are normal. They try to get out, but a lot of them they stay. They have to. They're not allowed to leave, and the head guy is like, yeah, I fooled you all. They actually aren't abnormal, but you diagnosed them as if they were. And then he says something like, I'm gonna trick you again in the next, whatever it was, year or something. I'm gonna send more people to your institutions. And then they start start thinking people are coming in from this guy, and then they start misdiagnosing people, and it's like, well, I actually never sent anyone. So he's just messing with them, just to show the subjectivity of the whole process of considering mental disorders. It's an interesting experiment, interesting read. Mental illness is a construct, an abstract controlling idea that is informed by the views of others and is intended to explain certain behaviors that differ from what is normal. This is not to say that no real physical problems exist in the brain that require treatment. So you must take note of that. It's very important. I circled it on my notes. Some are genuine disorders, autism, for instance. That's not the only genuine disorder, okay? That's why it's EG. Yes? Oh, yes. Yes. Yes, there is even, you could say, a spectrum for that. Yes. Others are more like spiritual issues. So the DSM has, or at least, I don't know if the fifth edition has this exactly in this language, but oppositional defiant disorder. What does that mean? Well, it just means you have a really disobedient kid. What parent doesn't have someone who has the oppositional defiant disorder? Or alcoholism. Now, they view that as a disease, but that's really a spiritual issue that we call idolatry, which has an effect on the body. It can be difficult to tell whether problems are mental disorders or spiritual problems, or a combination of both. And it really isn't the job of the counselor necessarily to parse that out. We have an out. We can say, if you think there's some physical problem, or maybe you suppose that there would be, you say, go see a physician, get a checkup, rule things out. And that doesn't mean that the counseling stops. It just means that there's more information that's helpful on how we can approach the counseling. Ed Welch helps us. You remember his, I think we talked about this in the area of depression, his book, Blame It on the Brain. Spiritual issues are moral. Ask a question like, does the Bible command this behavior? Does the Bible prohibit this behavior? Then we're talking about moral issues. Shame and guilt, fear, thanklessness, unforgiveness, hopelessness, anger. Those are moral, spiritual issues. There are other issues, more like physical issues, amoral issues. Can this behavior be described more as a strength or weakness? Alzheimer's, forgetfulness, shouldn't be rebuked. You shouldn't confront the person who has Alzheimer's, say, you are just negligent. You just don't remember things. You keep on forgetting important dates and procedures. You need to really grow in your memory. Sleep problems, weight changes because of thyroid medication, fatigue, concentration. That's not to say that fatigue or concentration or weight changes in general are not related to spiritual issues. If the person has taken speed, for instance, and doesn't go to sleep, eventually is going to crash and be fatigued and not be able to concentrate. Well, that's because of sinful taking of drugs. The problem with the medical mindset or psychotherapy here is that they assume that all extreme problems are thereby medical problems. If it's like a really bad problem, it's very severe, it must be medical, biological. That's not always the case. I don't know if you have some slots there under your notes, but I think I have given you some space there. Did I give you space? 4. Okay, then that fits my notes. So one of them here is King Saul. King Saul, he had a love-hate relationship with David. You might remember that. And David would evade death. Saul would back off for a moment, and then he would throw a spear at him. And this is a significant conflict. And you remember the Lord said that he would send lying spirits to King Saul, and then would actually use David's playing to soothe Saul. So the cause of the extreme, ends here of love and hate cannot be attributed to biological issues, but something from the Lord. Giving Saul over to Saul's own sinfulness, and even sending these lying, deceptive spirits. Another extreme problem in the Bible would be Job. Remember Job? He would scream and tore his clothes off and shaved his head. And if you just looked at his behavior, certainly he would be sent to some institution. But it wasn't biologically caused. He had extreme sorrow. He was full of grief. He had lost so much, and he was so confused as to why it was happening when he didn't do anything wrong. Not to say he wasn't a sinner, but he didn't have that sin, that one particular area of struggle that his friends kept telling him to look for. How about the third one, King Nebuchadnezzar? Remember when he was living in the wild as a beast? He was beastificated. Remember that? And what was the source of that beastification? It was divine judgment because of his own pride. And then there's also in Mark 5 that demoniac. He was running in a graveyard. He was calling out. He was breaking chains. He was cutting himself. He had this extreme strength, but his behavior was crazy behavior. And he was afflicted by Satan, by the strong man in the house, whose house was plundered by the stronger man, Christ. That would be Mark 5. I just assumed that since I preached through Mark, that I am preaching through Mark, you would know every reference in Mark's gospel. Sure. Yes, go ahead. Oh, yeah, I'm sure. I've not read the DSM through. I mean, I've only read portions of it. It's more of a reference. But I have it in my office if you want. If I can bring it, you guys can look at it tomorrow. Yeah, but they have a disorder for everything, so I imagine they would. I don't know what it would be called. I'm not an expert in DSM labels, but I would not be surprised if something like this would be given some label. Yeah. All right, let's keep going. As we're talking here about mental illness and the difficulty of parsing it out and distinguishing it from mental sanity. So we have to ask the question, what is normal? Is normal that which is typical or common? Well, that's one way that people understand normal. I don't think that's exactly how we ought to understand normal. But if we do understand normal in that way, then what's normal is sin. And if that's how we're going to understand normal, then we should expect things to not be normal because of the effects that sin has on creation. We would expect things like disorders, disease, death, destruction, etc. According to the APA and the DSM-5, defining normal is impossible. So here we get back to the DSM. Here's the quote. This is page 21 of the DSM-5. This is right from the get-go. Okay, this is their, I don't know if it's the prefatory or the introductory remarks, just setting things up. If you guys want to understand about all these labels that are coming up, know this. In the absence of clear biological markers or clinically useful measurements of severity for many mental disorders, it has not been possible to completely separate normal and pathological symptom expressions contained in the diagnostic criteria. They're essentially conceding our point. Now, they're not saying that what they're doing is entirely a fool's errand. Maybe we can call this academic honesty, trying to show the cards. Maybe they're being humble. It's really not possible to completely separate what's normal and what's pathological, what's disease disorder related. Of course, this we should read this quote and say, why am I going to read further? If you don't even know what normal is versus abnormal, if you don't even know what the standard is that you're looking for against which you can test all these other cases. If you don't know what's normal, how can you know what is abnormal? There's a whole class. It was a fascinating class that I took when I was first a psychology major in college. Abnormal psychology. All kinds of weird things. But it's fundamentally flawed. If they don't even know what normal is, then it's impossible to know how something has deviated and the degree to which it has deviated from the supposed standard. Under an evolutionary or secular view, a person's mental state or brain state is abnormal when his mindset, emotions, or behavior appears to cause mental strain, distress, or impairment. So, if a person is undergoing some distress, it's usually you have distress that's hampering functionality for a period of time, 2-3 weeks or so. Then you have a mental disorder. But not all mental distress or impairment is bad. If we live in a fallen world, we should expect things like mental distress. The WHO, not the band, but World Health Organization, defines mental health or normalcy as a state of complete physical, mental, and social well-being, and not merely the absence of infirmity. Now, they're getting somewhere. Though one wonders who would be normal, given this definition. Can anyone of us say that we've experienced a state of physical, mental, and social well-being? Complete physical, mental, and social well-being? I'm not there. The biblical view of normal is the image of God in which man was created and is to be. The Westminster Shorter Catechism, drawing from Genesis 1, Colossians 3, and Ephesians 4, we talked about these passages a while ago, understands the image of God in this way, that God created man, male and female, after his own image, in knowledge, righteousness, and holiness, with dominion over the creatures. So a normal human being, you could say pre-fall, would be good, morally perfect, completely harmonious with God's law, would have knowledge, would know God and would know himself as God has revealed himself and revealed the creature to be. He would be righteous. He wouldn't simply be neutral, but his will would be inclined always to righteousness. And he would be holy. His heart would be devoted to God. That is pre-fall Adam. He was good. He had knowledge. He was righteous. He was holy. True normal, if we really want to talk about what is normal, which norma is the standard, the proper thing, the right thing, that's the image of Christ. That is Christ. He is the image of God. He is the standard. He is the one that we are to conform our lives to. So if we want to know what the normal person is, then we look to Christ. That's a more biblical way of understanding normal. So anything that is deviating from the character and the conduct of Christ would be abnormal. And if we're not in full conformity to Christ, and we're not, then we would expect we would expect our character, our conduct to be different and to cause problems, to be off. The goal is righteousness. Anything less than that is a problem. In that sense, everyone is abnormal. Everyone is needed of healing. This is what Jeremiah says in chapter 17, that the heart is desperately sick, deceitful, above all things. He says, who can know it? Who can know the heart of man? And this abnormality manifests itself in so many different ways, as we've seen. We're at the tail end of this training. So we've seen sin, this abnormal lifestyle, manifest in sinful anger and sinful fear and sinful depression, and on and on. As we just looked at sexual sin, that's abnormal. That's not right. So we don't need to diagnose people with these psychiatric diagnoses and then prescribe some medication for something that is rooted in sin that needs to be addressed with the gospel. This is not to say that there is no true psychiatric diagnosis. I'm not going to say that. I don't know. But I would say it's a lot fewer than what we have in the DSM. It's probably just a handful, if I had to guess, based on just the extreme problems that I've seen and that I've read from men and women who are physicians, who are doctors and biblical counselors, and they're trying to understand, they're trying to label, what's truly medical organic issue and what's more of a spiritual issue. Christ is the great physician. God in Christ renews, he restores, and he heals. So section 3 under chemical imbalances, I told you we won't be looking at a lot of this because this is actually duplicated. A good portion of this is duplicated from our time in the lesson on depression. So I'll just refer you to 3 points here. E, this is from the Chemical Imbalance Delusion from Berger, Daniel Berger II. He says, if there are no known balanced chemicals, a standard, then there can be no chemical imbalance, a deviance. That's a really important quote. You might remember earlier from Hodges and others, I think Welch. We don't know. He says what the right levels, what the proper balance of serotonin and dopamine and all this ought to be. So it's really hard to say if you don't have as much as you ought to have. It's really hard then to say if there's an imbalance. And so if there is no known balanced chemical level, if there's no standard, here's what a male at age 35 needs to have. Here's what a 5-year-old female needs to have. If there isn't that standard, then you really can't speak authoritatively regarding an imbalance. You can't say, well, that kid or that adult has an imbalance. You don't even know what the standard is. Again, this is not to say that chemical imbalances do not exist, but this is one of those, I'll believe it when it's proven. And the onus is on the chemical imbalance theorists. And I'll tell you that, and Berger has shown this through his book, The Chemical Imbalance Delusion, that most psychologists, psychotherapists have just abandoned this as a legitimate theory. It's just that it's so easy to communicate, it's so easy to push medication and to simplify a person's problems, especially in advertisement. You have some imbalance, and we have medication to make the difference. It's really easy to just promote it that way. You don't need to know all the science. Right. This is point E3 or H. Even if there were a test for imbalances, the test could not tell you if the imbalance was the cause of, for instance, the depression, or if it was the result. The whole chicken or the egg comes into play here. This is not to say that people do not feel better after taking some medication. We know that they do. But there's no logical or medical reason to prove conclusively that the effect was due to the cause of medicine. There have been so many placebo studies with placebos. The whole placebo effect, if you've taken Psychology 101, you kind of know about that. There have been so many placebo studies that have, for the most part, shown about the same percentage of help, for those who had the real medication versus those who had just a placebo. The difference is negligible. Do antidepressants work? And again, I'll refer you to that video by Jeremy Pierre, Is It Okay for Christians to Take Antidepressants? But very briefly here, yes, they do work. If the problem is not organic, oftentimes the symptoms will be treated at least temporarily. So sometimes it's good to have an antidepressant, some medication to stabilize an individual, to help the person focus so you can actually address the underlying issues. And then you can suggest that that person talk with their doctor and see about easing off and eventually going off of antidepressants. If the problem really is organic, then and if the medication is prepared properly, then it's going to do what it's supposed to do. But that would be more rare than anything else. But then also no, they don't work in the sense that they treat symptoms, but they don't treat the problem. I don't know of any antidepressants that actually address the problem. Most doctors, psychotherapists they admit that we're dealing with symptoms. So again, the patient has listed off symptoms, and the expert in what different medications do and how they work with other medications that the patient might be on is going to tell you what combination you need to have to treat the symptom and not, not make it worse, so you can actually function. And you know as much as I do that any medication's got side effects. So you have to decide, what are you going to do? Are you going to take the weight loss, the weight gain? Are you going to take the risk of being depressed if you take an antidepressant? You have to weigh the pros and cons. And for some, at least for a time, it's worth taking the medication. And for others, it's not. Some people who are on the medication, they say, I want to get off as soon as possible. And they work with a doctor to do that. Others say, this has been very helpful and want to stay on it to continue to function. And that's their choice. We wouldn't want to lay undue guilt or burden on people who take medication. Were you going to say something, Robert? Okay. And then finally here, Jesus and mental illness. This is primarily from Lambert's book, The Gospel and Mental Illness. Of course, we know that Jesus addressed the spirits of his people. He addressed the souls of the people. He diagnosed the problem to be the heart of man, and then addressed the heart of man. And what was the solution to man's sinful heart? Of course, it is Christ himself, the Redeemer. But Jesus also addresses the bodies of his people. It is Christ who uses his common grace to use his creatures to help other people. As people discover new technologies and make new medication to help other people. Who is it that has given those people the ability to understand? Well, it's Christ. So even Christ can work through non-Christians to help non-Christians and to help Christians. No, what do we have that we were not first given? And even the unbeliever has the rain, the rain falls upon the just and the unjust. That's all coming from God. Any temporary relief is coming from God's common grace. It is Christ who has worked miracles of healing on people's bodies. He made that crystal clear in his ministry. Even when the disciples who were given the authority, for instance, to exorcise demons, couldn't, because they lacked faith and the commitment to the Lord, it was Christ who showed that he is the one from whom this power comes. He's the one who heals people's bodies. And the Lord even heals people's bodies today. Yeah, he does that through natural, through ordinary means, but he's not opposed to throwing down a miracle and healing people. He's been known to do that, hasn't he? It is Christ who comforts us when we are beset by physical problems. Usually, our struggles are related to some degree to physical problems. Loss of physical ability, loss of job, loss of money, and on and on. And these affect our physical lives. Well, who is it that will come and comfort us in our trial? It's Christ himself. Because of the evanescence of physical relief, every medical treatment will fail. That's true. But it is Christ who offers us a glorified body that will never weaken or die. We should not put our lasting hope in the maintenance of our physical bodies. And we mustn't think that we can only be sanctified when our bodies are healthy. Sometimes counselees will adopt that posture, that perspective that, if they're undergoing some physical problem, then the Lord has left them, or this needs to be corrected so that they can grow. Well, the Lord is actually using that to help them to grow. The Lord cares about the spirits of his people. The Lord cares about the bodies of his people. And every physical relief will eventually end in death. The gospel is more important than medication. It is more important than chemotherapy. It's more important than blood thinners. It's more important than an ECT or open heart surgery. It's more important than your back pill, getting insulin. It's more important than having that kidney stone destroyed. It's more important than thyroid medication. The gospel is more important than all of these. Now, these are useful. But our hope, your counselee's hope, should not rest in any of these or anything else but the gospel. And the gospel is what biblical counselors, of course, are all about. Remarkably, this is the end of the notes. Are there any questions before we turn in for the night? What was that? Oh, I'm a little surprised that we got out this early, but that's okay. I'm sure Matt Cole will appreciate that, and you all as well. So we come back again tomorrow at 9, and we're going to address the practicalities of sitting down with someone, certain questions to ask, involve yourself in their lives, give them some homework, things like that.